Now, let's talk about differential diagnosis and comorbidity. First, let's talk about why differential diagnosis is so important when it comes to generalized anxiety disorder. So, it's essential because generalized anxiety disorder should not be diagnosed if the symptoms are better explained by another disorder, a medical condition, or a substance. And the following that we're going to get into is an overview of when a differential diagnosis may be more accurate. So let's talk about anxiety due to another medical condition. So if the excess anxiety or worry is actually the physiological result of a medical condition such as hyperthyroidism or pheochromocytoma, then the correct diagnosis is likely anxiety disorder due to another medical condition and not generalized anxiety disorder. So these are two key medical conditions to look out for, and collaborating with a client's primary care provider is essential. Medical evaluation and lab findings guide this determination. Now let's talk about social anxiety disorder. So, if the anxiety is specifically focused on social or performance situations and the core feature is negative evaluation, then social anxiety disorder is the more accurate diagnosis. Generalized anxiety disorder involves worry across many areas of life and is not limited to social scrutiny. If the anxiety disorder, if general anxiety just disappears outside of social situations, it's probably not generalized anxiety disorder. So, again, social anxiety disorder focuses specifically on one domain, and that's the social domain. Now, separation anxiety disorder. So, there's a lot of overlap with generalized anxiety disorder and separation anxiety disorder. How do you tell the difference between the two? When the individual's worries revolve almost entirely around separation from attachment figures and other worry themes are minimal or absent, then separation anxiety disorder is the appropriate diagnosis. Generalized anxiety disorder, unlike separation anxiety disorder, requires excessive worry across multiple domains. So, again, separation anxiety disorder is domain specific, whereas generalized anxiety requires worry across multiple domains and not just worry about separation. Now, what about panic disorder? So, in generalized anxiety disorder, panic attacks may occur. So, panic attacks are a feature of generalized anxiety disorder, but they're usually triggered by worry and therefore do not justify a separate panic disorder diagnosis. So, that's something important to keep in mind is that if someone experiences panic attacks, that doesn't necessarily mean that they automatically have panic disorder, and it's just a natural feature of generalized anxiety disorder for some. However, if the individual experiences unexpected panic attacks that are uncued, kind of out of the blue, along with persistent concern about future attacks or behavioral changes to avoid them, then panic disorder should be diagnosed. And it's important to keep in mind that this is a possibility in addition to generalized anxiety disorder. So somebody can have panic disorder on top of generalized anxiety disorder. Now, let's talk about obsessive compulsive disorder. If the person's anxiety stems from intrusive, unwanted, irrational obsessions, such as intrusive images or urges, rather than realistic life concerns, then OCD is the more accurate diagnosis. Generalized anxiety disorder worries are excessive, but typically involve real world themes such as finances and work performances. Now, what about illness anxiety disorder and somatic symptom disorder, which formerly might have been called hypochondria? If the person's only or primary worry is fear of having a serious illness, the diagnosis is illness anxiety disorder, and not generalizing anxiety disorder, most likely. If the anxiety centers on multiple distressing physical symptoms, somatic symptom disorder may be more appropriate. Generalized anxiety disorder requires a broader range of worry topics. So, again, you see the common theme here. Generalized anxiety disorder must span across multiple domains and not just on one's health or their illness. So, if there is a specific fear about having a serious illness, then that's probably illness anxiety disorder. And if there are multiple worries about multiple distressing physical symptoms, even though that's a bit more expansive than illness anxiety disorder, that more likely meets the criteria for somatic symptom disorder and not so much generalized anxiety disorder, since worrying about multiple distressing physical symptoms or illnesses, while more expansive, still falls under the umbrella of general health, and therefore it's limited to that one domain and does not meet the criteria for generalized anxiety disorder. Now let's talk about depressive, bipolar, and psychotic disorders. So, anxiety and worry can occur in mood or psychotic disorders, but generalized anxiety disorder is diagnosed only if the anxiety is a major independent focus that warrants attention. If the anxiety is better explained by mood episodes, psychosis, or associated features, then generalized anxiety disorder should not be diagnosed. So it's important to note anxiety and worry can occur in mood or psychotic disorders. However, that's generalized anxiety disorder is only diagnosed if the anxiety is the major independent focus. Now, what about post traumatic stress disorder? So, if the anxiety and worry are primarily connected to trauma, then, or hypervigilance, re experiencing, or avoidance behaviors, the correct diagnosis is PTSD, most likely. And generalized anxiety disorder should not be diagnosed when PTSD fully explains the symptoms. So, again, you can have worry and anxiety that span across multiple domains when it comes to post traumatic stress disorder. However, the main difference is that they're connected to trauma cues and often involve hypervigilance, re experiencing, or avoidance. Now, what about general comorbidity? So, a high proportion of individuals who meet the criteria for generalized anxiety disorder are also likely to meet or have previously met criteria for other anxiety and depressive disorders. This pattern of high occurrence is partially explained by shared risk factors, including the temperament of negative affectivity, also known as the personality trait neuroticism, and shared genetic and environmental antecedents. When considering sex differences, comorbidity patterns differ. For women, comorbidity is largely limited to depression and other anxiety disorders. But in men, comorbidity is more likely to extend to substance use disorders as well. Comorbidity with neurocognitive, neurodevelopmental, conduct, psychotic, and substance use disorders is generally less common than with anxiety and depressive disorders. That is to say, you are more likely to see a client or a patient who has comorbid anxiety and depressive disorders than other conditions. All right, now that we've covered that, let's dig into evidence based treatment next.